Assalamu alaikum. Once again me Dr. Salman. Today I will talk about routine vaccination in Pakistan. An 8-year-old child comes after roadside accident with a clean wound. He had his last booster dose of tetanus vaccine given 3 years back. What should be your plan? A. Tetanus toxoid. B. Tetanus immunoglobulin. C. Tetanus toxoid plus immunoglobulin. D. Another booster of the tetanus vaccine. E. No vaccination. Answer is E. No vaccination. Routine immunization protects your child against 10 vaccine-preventable diseases, which includes: Number 1 Bacillus Calmette-Guérin, BCG, 2 polio vaccines, OPV, IPV. Third is pentavalent combinations of 5 vaccines altogether comprising a fixed combination of diphtheria, pertussis, whooping cough, tetanus. These initial 3 are called as DPT plus hepatitis B and Hib. Fourth one is rotavirus vaccine, for diarrhea prevention due to rotavirus, and sixth one is measles. Routine immunization schedule in Pakistan. Children are vaccinated 6 times in 15 months against 10 different diseases. At birth the following vaccines are given: 1. BCG. 2. OPV0. 3. Hep B. In the second visit at age of 6 weeks. 1. OPV1. 2. Rotavirus 1. 3. Pneumococcal 1. 4. Pentavalent 1. Third visit at the age of 10 weeks. 1. OPV2. 2. Rotavirus 2. 3. Pneumococcal 2. 4. Pentavalent 2. Fourth visit is at the age of 14 weeks, in which the following vaccines are given to infants: 1. OPV3. 2. IPV. 3. Pneumococcal 3. 4. Pentavalent 3. During fifth visit at the age of 9 months, measles 1 is given. And finally, sixth visit at the age of 15 months, measles 2 is given. History of API vaccination. In 1976, pilot project was started with 6 basic antigens included: BCG, polio, measles, diphtheria, pertussis, tetanus, DPT. In 1978 this project was expanded nationwide. Afterwards in 1981 these immunization activities were intensified. 1994, National Polio Immunization Day. In 2002, Hepatitis B vaccine were introduced. In 2009 for the first time, pentavalent vaccine were introduced. 2012-14, pneumococcal vaccine PCV were included in the program. 2015, inactivated polio vaccines IPV were introduced. It was in 2017 that rotavirus vaccine included in the API program. 2019, typhoid conjugate vaccine TCV was introduced only in Sindh. Finally in 2021, measles rubella vaccine MRV, inactivated polio vaccine 2 IPV2, and typhoid conjugate vaccine TCV were introduced only in Punjab and Islamabad. Note: rubella infection is more dangerous in early pregnancy. Chickenpox infection is more dangerous late in pregnancy. Dangerous to mother, fetus, neonate and children. Herpes zoster shingles, varicella zoster chickenpox, herpes simplex numbness and vesicles around lips. A 56-year-old male, known case of chronic myeloid leukemia comes to your clinic and asks for vaccination against different diseases because of his immunosuppressed status. Which of the following vaccines should not be given to this patient? A. Hepatitis A. B. Hepatitis B. C. Tetanus. D. Influenza. E. Oral typhoid. The answer is oral typhoid vaccine.
A 23-year-old female nurse has a needle stick injury while drawing blood from a patient with acute hepatitis B. She received HBV vaccination 4 years ago and had a documented response to the vaccine. What will be the most appropriate next step in her management? A. Administration of HB immunoglobulins. B. Booster dose of HB vaccination. C. Administration of both immunoglobulins and vaccine. D. Check HB's AG level. E. Just reassure her. The answer is E. Just reassure her.
An 18-year-old male presents after he is bitten on his left leg by a provoked pet dog 10 days ago. The dog has been restrained for the last 10 days. The boy has received 3 doses of vaccine. The dog appears normal on the 10th day. What will be the most appropriate step at the stage according to WHO guidelines? A. Stop vaccination. B. Immunoglobulin only. C. Vaccination only. D. Vaccine and immunoglobulin both. Answer to the question is A. Stop vaccination. A 23-year pregnant woman presents with a history of rash 1 month ago. She is at the 20th week of gestation. Her lab reports show rubella IgM negative and rubella Ig negative. What is the single most appropriate step in management? A. Reassurance is she is immune. B. Rubella immunoglobulins. C. Rubella vaccine after delivery. D. Rubella vaccine now. E. Rubella vaccine and immunoglobulins. Answer is C. Rubella vaccine after delivery. A 17-year-old boy was playing with a camel brought for sacrifice on Eid day. Many neighborhood children gathered around the camel, due to which he got irritated and bit the boy holding the rope. The boy went to a nearby doctor, who cleaned the wound and gave antibiotics and painkillers. He has come to you for advice regarding further management. The boy had received all primary vaccinations according to AP. What is the single most appropriate step in management? A. TT vaccine. B. ATS. C. ATS plus TT vaccine. D. Reassurance. Answer is A. TT vaccine. You administered MMR vaccine to a 19-year-old girl. Next day she comes with her husband with a positive urine pregnancy test. How would you manage this patient? A. Advise abortion. B. Advise rubella IgG. C. Advise rubella IgM. D. Amniocentesis. E. Continue pregnancy. Answer is E. Continue pregnancy. A woman is migrating to the USA and is required to do her adult vaccination. She is 3 months pregnant. The vaccine contraindicated for her is A. Varicella. B. Hepatitis B. C. Injectable polio vaccine. D. Tetanus toxoid. E. Influenza. Answer is A. Varicella. Please share, comment, subscribe to my channel and press the bell icon. Thanks. Allah Hafiz.